this idea that the high intensity stimulation is not effective, what we wanted to understand was a little bit more about the neurobiology of that. So like, why would high intensity not be effective? It would make some sense if you could turn up the stimulation intensity and get your effect and then maintain your effect as you continue to turn it up. That wouldn't be particularly surprising. The idea would be that at some point you get all of the fibers in the vagus nerve that you need, and more stimulation doesn't do anything that's problematic. However, that was not what we saw. So we wanted to understand a little bit more about what high intensity VNS was doing. And so this experiment was built on the idea that either high intensity stimulation is going to produce an effect that would just simply not be beneficial, or on the other hand, what it might do is be actively inhibit. We can't differentiate that if the only thing you do is high intensity stimulation. So we designed an experiment where what we did was to do either moderate intensity stimulation or moderate intensity stimulation that was interleaved with high intensity stimulation, with the idea that if high intensity stimulation, if what it is doing is simply not improving recovery, interleaving it with moderate intensity stimulation, you should still get the benefits of VNS. If it is actively inhibiting recovery, then interleaving it with moderate intensity should block your effects of VNS. And unfortunately, indeed, that's what we saw, was that the high intensity stimulation blocked the effects of moderate intensity stimulation. And so from a clinical perspective, this is not particularly relevant in terms of treating patients. Like if you're applying this, if you're a therapist and you're applying this, you're not going to be turning the intensity back and forth between moderate and high intensity. You would use moderate intensity because that's what we know works best. But what this does tell us is it reveals a little bit about the underlying consequences of what VNS is doing. And so what we can take away from this is that when we're delivering high intensity stimulation, we're releasing more neuromodulators. We know that. And what's probably happening is that is causing more desensitization of the receptors. And as these receptors become more desensitized, now the moderate intensity stimulation can't have its beneficial effects. So really, this is more important for understanding the neurobiological mechanisms than it is from a clinical perspective. But hopefully this will help us as we go forward, as I mentioned before, sort of individualizing this therapy.